Mercy Medical Center's live webinar. Today we'll be discussing care of aging parents. Joining us are Brenda Hogan, Mercy Nurse Manager with Hallmar and Private Duty, and Colleen Knipper, Physical Therapist at Mercy. After their discussion, they will take questions live from our audience. To submit your questions anytime during the discussion, go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with a white arrow. Your questions will be anonymous, completely confidential. So let's get started. Brenda Hogan is going to begin.
Good afternoon. Today we're going to talk to you about aging with the individual and the family, the importance for you as the caregiver, your options to help improve quality of life with your parents. We'll also discuss some exercises to help strengthen your mind and your body, and also some tools to improve and maintain independence for your parents, and then what to do if you decide that you do need help and what are your options. So let's look at some census data from this most recent census. So in the last year, when we had census data, it looked like we had over 6 million people over the age of 85. As you can see, our trend of our elderly ages just continues to increase. By the year 2030, it's predicted that we'll have over 9 million people in the United States in that over 85 age group, and by the year 2050, over 20 million. So as you can see, our population is definitely going to age, and the number of people in that group will as well. Currently, there's about 5% of this 6 million population that are in institutional care. So as the years go by, we're going to see that there's definitely going to be an increased need for assistance of our elderly. Changes in aging are thought to occur because of a combination between a functional decline due to disease, inactivity, and the aging process itself. Some say that normal aging is a combined effort of aging, disease, environment, and lifestyle. Successful aging occurs with the aging process is not complicated by any of these things. There are some normal changes that we can expect with aging. Starting with appearance, it's not uncommon to see a shortened height. Beginning at around the age of 50, we can notice over the next 20 years that the elderly will see between 1.5 and 3 inches of loss of their height due to the thinning of your vertebral disc. Our bones naturally lose calcium with age, and if there's somebody who has excessive calcium loss, a condition called osteoporosis can occur. And osteoporosis is 4 times more likely in women. Our muscles become weaker due to inactivity and also the decrease in the neuron cells that are within our cells, in our muscles, and then stamina and strength are much less. And compared to when we're 25, we can see as we get older that our stamina and strength decrease by as much as 65%. There is also less subcutaneous fat tissue, and that causes us to have the appearance of wrinkles. And then you may notice with some elderly people that they're cold, or they tend to feel a little bit more cold, and it's because of that less fat. We also have some metabolic changes. Our skin cell replacement is much slower, and so the healing process takes longer. We have some body weight changes due to less lean body mass and loss of body water. Our heart function is impacted, which can lead to conditions like congestive heart failure and high blood pressure. And our kidney and liver functions can decrease, causing some changes in our ability to regulate the fluids and maintain balance within our body. Our nervous system changes where our brain nerve cells gradually deteriorate and die. When an elderly person has a medical or physical stress, they can have some confusion or delirium or even depression resulting. Intellectual performance of the elderly without any brain dysfunction remains pretty consistent beyond the age of 85. However, the performance of tasks may take longer, indicating some central nervous processing is slowed. Subtle changes such as forgetfulness may occur and are expected. Some sensory changes occur, such as a decreased perception of pain. There's also fewer taste buds, which affect how we taste. Our smell perception declines. We have visual changes that occur, and hearing loss is frequently seen. About a third of the persons aged 65 to 74 have some level of hearing loss, and as many as half of those over the age of 75 have hearing loss. Our immune system decreases in its tolerance to antigens, and we also have a slowed response to reactions to infection. There's lots of research out there currently that's linking the relationship between biochemicals and genetics and how it relates to the way we age and our lifespan. And then also changes can be related to medication. Most elderly use medications at some point in their life. When they use them correctly, they're of great value. As the body grows older, the percent of water and lean tissue and an increase in fat tissue affects the length of time that a drug stays in our system. The lessened kidney and liver function slows, and it slows how quickly the drug leaves our body, and many drugs can cause some temporary cognitive impairment in older persons. So as an aging person is taking medication, it's important to monitor the dosing and the effects. Despite all these changes, most aged individuals can continue into a healthy old age. They have wisdom, judgment, and lots of retained facts and information. With all these changes going on in our elderly, the effects on your relationship can be significant, especially if you're the primary caregiver. Being aware of what to expect to come will help you manage those changes. You may find yourself assisting your parents with many different things. You may find that there's a role reversal in multiple areas. Starting with financial. Certain tasks like writing checks or balancing a checkbook, doing taxes, and managing financial and legal matters may be too overwhelming for an elderly parent. As a caregiver, be prepared. Turn to family and friends, professional or community resources can be very helpful as you transition your parents into their aged years. There can be some denial from your parents, and it can be difficult for them to ask and receive help in some tasks that they formerly completed. This is an area that can cause a lot of stress and conflict within the family. It may even cause some resentment of other family members who live far away if they're not able to facilitate in the changes that you're seeing. There could be some disagreements between family members in how financial and care needs are addressed. To help minimize these conflicts, have family meetings and discuss each person's role and responsibility and share their feelings. It's important to recognize the difference of each family member and to share responsibilities based on their preferences and abilities. Communication is very important among all family members when you're looking at caring for your aging parent. Another change that you may see is managing moods and behaviors. With the mental and physical changes that we've talked about before, an elderly person may feel irritable or depressed. They may have a loss of interest in their usual activities or a change in their appetite. And if these changes are recognized, you should contact their physician and they can help with the next step. And maybe medication or some other treatment would be appropriate. Managing daily care such as bathing is also something that you may have to help change and would change in your relationship. You may notice that your parent is not meeting their bathing or their personal needs. In some families, there may be someone who can help the aging parent with their bath or shower or check in on them frequently throughout the day. In other families, this really isn't possible. I've recognized with many elderly, having somebody come in and check on them, even as little as twice a week, helping them with a shower and helping them with their household tasks, can really help them feel not dependent on their family and really help allow them to maintain independence in the home. Most families have difficulties addressing the needs of their parents, yet this is one of the most crucial items needed to help them maintain their independence at home. So now you've identified that your parents need some help, but what about you? It's very important that you take care of yourself as a caregiver. First of all, you need to make sure that you're managing your stress. You may be going through feelings of denial or anger You may be socially withdrawn because of the amount of time you're needing to help with your parents. You may have some anxiety based on the needs that the new responsibilities that you have, or even some depression related to the changes going on with your parents. You could feel exhausted or have some sleeplessness, maybe even irritability and lack concentration. And if you don't take care of yourself, you may end up with some health problems as well. The whole goal for you is to stay healthy. Make sure that you're following a good diet, you're getting lots of exercise, and getting rest. Taking care of yourself is very important as you take care of your aging parents. The other thing is to be educated. Learn about what's going on with your parents. Understand their disease process and what's to come. There's lots of resources available throughout the community. Some of my favorite is going to the Alzheimer's Association, the Alzheimers.org website, or Aging Services. They have great resources for people that are going through aging changes and needs that way. And don't be afraid to get help. There's lots of opportunities out there in our communities. The other thing in taking care of yourself is making sure that you're accepting the changes. Be flexible with the changes that are going on with your parents, and know that the way you may have behaved or acted at one time could be different in how you react now. Also be realistic about the abilities of your parents. They may not be able to do the things that they were able to do before due to some of the physical changes we already talked about. And then avoid guilt. Don't be feeling badly when you're not able to provide the care or the services to your parent and you need to ask for help. So now we've talked about improving yourself. Now we want to improve the quality of life of your parents. So when we talk about managing physiological needs, it's really looking at their nutrition and rest and activity. So make sure that your parents are getting their adequate nutrition. Monitor their grocery bills if you need to, and really look at how much is being consumed out of the cabinet. Also monitor their ability to chew or swallow, or if they have some concerns with their teeth or dentures, a dentist might be very appropriate to help with that. Maybe something as simple as changing the diet to more softer food will help your parent to eat a little bit better. Another physiological need would be rest. Making sure that your parent has a regular sleep pattern. This may require that they take naps during the day, and if this is a concern, looking for a cause for the sleep disturbance can be very helpful. It might be as simple as getting a better pillow or a better mattress for them, or maybe taking a pet out of the room when they're sleeping at night. Activity would be another way to manage their physiological needs, having them keep active. And Colleen will talk a little bit more about that in a little while. Looking at your parents' safety and security needs is also very important. It may be rearranging the home or adding some devices into the home that help them be a little bit more safe and secure in their environment. Looking at their own self-esteem is important as well. If you have two parents, a well parent and an ill parent, they still have their need for intimacy. And when they have greater needs that show up, they may feel a loss of control over the situation. So be mindful of what their personal needs are and what their needs are between each other. The relationships may change. They may be feeling a lot different about the relationship that you have with them or the relationships that they have with their friends or their loss of friends. And also they might be feeling some isolation or loneliness or alienation because of their inability to be out into the community or be able to do the things that they used to do without problem. The other way to improve your parents' condition is to help manage their chronic problems. Knowing more about your parents' disease and how to cope with the changes that are happening, taking care of any pain or comfort needs that they may have, or mobility. Mercy offers a great program, Successful Living with Chronic Disease, which really helps give people the tools on how to manage their symptoms and how to cope with their changes of aging. I'm going to turn the program over now to Colleen, and she's going to talk about maintaining independence.
As Brenda has mentioned, helping your parents to maintain as much independence as possible can be beneficial
beneficial for them in terms of maintaining their self-esteem, keeping them safe, helping them to feel like they aren't having to give up as much as possible. The first thing that we're going to talk about here is some different types of devices and adaptation that can help maintain independence as you start to see a decline in mobility, some unsteadiness, concerns of falls. There's a variety of different types of devices that can help with mobility. It can be something as basic as a cane that they can use for a little bit of extra balance and stability. Different types of walkers. There are a couple of those pictured on your screen here. Standard walkers with the 4 straight legs, or the ones that have the 2 wheels on the front, or the 4-wheel type walkers with the seats and the basket. Anytime you're looking at getting a device to help with mobility, it would be a good idea to talk with a healthcare provider to make sure that the device that you select is appropriate, fit properly, and that your parent knows how to use it to maximize their safety. If you have concerns with continued falls, even with some of these devices, like the walkers and the canes, a wheelchair may be another option to help decrease the risk of falls while still maintaining mobility. Maintaining independence with activities of daily living, or ADLs, is also important. One of these is dressing. Just being able to get up in the morning and get themselves dressed can make a big difference in terms of how people feel about themselves. And there are a lot of different kinds of dressing aids available. Pictured on the screen here, you can see a long-handled shoe horn, which can help people get shoes on and off, and a sock aid, which can be used for those who prefer to wear non-skid socks or those who need to use some type of compression stockings in addition to regular socks. Also available are dressing sticks that can help when there's limited mobility or reach in the arms to get the clothes on and off and to work on fasteners. For bathing, oftentimes standing in a shower or getting in and out of a bathtub can be very difficult and at times unsafe. There are different types of chairs that can be put into a bathtub or a shower so that your parent can sit in the tub or in the shower without having to handle the negotiation in and out. Shower chairs or tub transfer benches are both options, as well as things like handheld showers and grab bars in the bathtub or shower area. As far as toileting, sometimes toilets become low and can be difficult to get up and down from. Raised toilet seats or a commode, such as what's pictured on the screen here, can help to make it easier to get up and down from the toilet. Or if getting in and out of the bathroom becomes difficult, the commode can be placed anywhere in the home to make it more accessible while still allowing them to maintain cleanliness and hygiene. In addition to the equipment that can be brought into the home, sometimes adaptations can be made to the home that also help increase safety and improve mobility. Some examples of these would be railings, if there are stairs that need to be negotiated on a regular basis. A chair lift, if the stairs do become too difficult, can also be installed to allow them to sit as they're raised up and down the stairs. Ramp entrances to the front door or back door or in and out of the garage can eliminate the need to negotiate steps in and out of the house. And grab bars can be placed in doorways, bathrooms, along the side of the toilet to give extra support to help with transfers and transitional movement. Another thing that's important in helping to maintain an active lifestyle is just to remain active and to get exercise. Before beginning any type of an exercise program, it's always best to consult with your parent's physician to find out if there are any restrictions or recommendations as far as how to progress. But some of the things that can be done to help maintain exercise, walking is a great exercise that most people can participate in within the guidelines that they've been given. It can be walking in the house with a timer or with a device and walking laps or lengths of a hallway, walking outside. It may be something that initially they need someone to go with them to keep them safe, and again, those guidelines can be given by the physician or healthcare provider. There are also different types of exercises that can be done to maintain the strength, particularly in the legs. We are going to go through a few of these exercises quickly here. The program information will be archived at mercycare.org if you want to go back and get more information or print off pictures of the exercises. Exercises that can be done lying down in the bed are often a safe way to begin working on strengthening without having risk for falls such as you would have with standing type exercises. An ankle pump, moving the toes up and down, helps to maintain flexibility at the ankle and promote circulation. Gluteal squeezes, squeezing the muscles in the buttocks, help maintain the strength in the extensors and can help improve posture. Quadriceps, squeezing the muscles on the front of the thighs, work the muscles that help with moving from sitting to standing and help maintain stability while standing. Hip abduction, moving the legs in and out, help to maintain strength in the muscles on the sides of the hips. And exercises such as a straight leg raise can also help with hip flexor and quadriceps, the muscles on the front of the thigh, to maintain strength in those muscle groups. For those who find lying down to be uncomfortable or have difficulty getting in and out of bed, exercises can also be done in sitting to strengthen the leg muscles. Sitting and straightening the knee, again, works the quadricep muscle on the front of the thigh. Knee raises or marching while sitting help to strengthen the hip flexors, the muscles that lift up the leg. And the heel and toe raises, again, can maintain strength and flexibility in the ankles as well as promoting circulation. I'm going to turn the program back over to Brenda now to talk about some options that are available for additional assistance. So you've identified that your parents need some help in the home. The one thing that I encourage people to do is look to your friends. See if there's someone who can help you. Friends and family are a great resource as you're looking for help for your aging parents. Sometimes even getting just a homemaker coming to help with those simple tasks like cleaning and housekeeping and laundry can be very beneficial because a lot of those activities become taxing on your parent as they get older or their conditions change. You could get an aide coming in to help with bathing and personal care, making adaptations to the home to make it safer for your parent, putting ramps in, putting grab bars, a lot of different options in those areas. And there's a lot of community resources that you can look to. Some of my favorite referral places include Heritage Agency on Aging and Aging Services. They have some great opportunities and social workers that can help with people within the community. Also, there's the Lynn County Aging and Disability Resources. The Alzheimer's Association is also a very appropriate place to go to get some suggestions. If you're finding that home is not a place that your parent can live, then there are some facility-based options. There's residential care living where they live somewhat independent, but they can get the assistance they need and the level of assistance that they choose, as well as there are some services available depending on the residential facility that they choose to go to. Assisted living will offer them a little bit more help. In many cases, meals are provided, or at least most of the meals are provided during the day. They can get assistance with bathing, and their level of care, their needs can be met based on what their individual needs are. And then if you're finding that your aging parent needs a lot more help in a lot more areas, long-term care facilities would be very appropriate for them. Caring for your aging parent can be very difficult. For many of us, this is a role that we're not familiar. As a caregiver, you need to take care of yourself. Be comfortable discussing your parent's condition with them and the options as well to improve their quality of life. There are many tools out there to help you. Stay fit and active, keep strengthening your mind and your body, and be accepting when you need to adapt to change for your parents. Thank you.
Thank you, Brenda and Colleen. Excellent information. To remind our listeners, your questions can be submitted from the box in the upper right-hand corner of the screen. To begin with our first question, Brenda, this is probably for you. Will Medicare pay for someone to care for my parents in their home?
I have this question asked quite a bit, and Medicare does pay for some services in the home if the patient meets the criteria of Medicare, which is that they have to be homebound, they have to have a physician's order, and they need to have a skilled need. And most of the time, these skilled needs are very short-term and temporary. The needs could be anywhere from a 3-week to could be a couple of months of assistance. But for the most part, Medicare does not pay for the type of service like someone coming in to help clean their home and things like that. So many people have to pay for this privately, or if they meet financial means, Medicaid is also an option.
Sounds like there's a lot of differences. Is there a number? Who would they call if they had some specific questions?
Related to whether they would qualify for Medicare to cover it, the person to contact would be their physician. So, because your doctor would know what the Medicare guidelines are and if you qualify for Medicare. So that's always a great resource, looking to your physician and to your physician's nurse. You also could contact places like Aging Services, Heritage Agency on Aging, or Lynn County Aging and Disability Resources. All of them have all of the information of the different types of options that are available for our elderly and can help direct people depending on what their finances are and really give them some options and lead them in the right direction.
Very good. Our next question, would you recommend long-term care insurance?
Actually, long-term care insurance I think is a great thing for some people, and for other people, they don't always feel the benefit of the long-term care insurance. I think that's something that's very personal that you need to ask yourself on whether long-term care insurance is the right thing for you. It can be very expensive. Many long-term care insurances have an elimination period, and then also they have a level or a certain amount of time or dollars that they'll pay for somebody's benefit. The thing about that is you really have to weigh whether that's the right fit for you, because it can be very expensive. I would really look at what you feel your finances are, and also look at historically, like how long did your parents live, what level of care they had, and maybe going to some of those things like what is your current lifestyle and your activities, and some of those things that may affect your ability to remain independent as you get older.
Okay, we have another question. If my mother has a knee replacement, will Medicare cover surgery and care after?
Okay. I'm not real familiar with how Medicare, or what the percentage of Medicare covers related to the surgery, and that might be something to you could always check with a billing office that's familiar with that. But Medicare does cover knee replacement if it's very appropriate to whatever the deductible is. As for the care after the knee surgery, many people are homebound for a short period of time, and actually I can let Colleen kind of talk a little bit more about that because that's more of her expertise area.
Following the knee replacement, typically Medicare will cover to have a skilled nurse and or a physical therapist come into the home if ordered by the doctor, as long as the parent meets the criteria for homebound status. And basically what Medicare defines that as is that the individual is not able to get out of the home on a regular basis, and that when they do, it takes a taxing and a considerable effort to do so. So typically that will be a few weeks following the knee replacement that they will cover those kind of services in home if they qualify.
Okay, very good. We have another question. My children live in another state. Who can I go to for help as I get older and a little more frail?
This is quite interesting. I have people talk to me all the time, and I think probably the one thing that's very important is to get intervention early and have some help in place. As you can see, our population of our elderly is just going to continue to climb. And so at those first signs that parents need help, it's a matter of taking the initiative and getting the help and start getting services. And I've taken care of many of people who have been able to live at home even as their disability becomes more and more debilitating, because they have some help in place, they've gradually been adapting their home. I think the people who have more problems in adapting to those changes are ones that kind of put it off and wait, and then the condition is so bad that they really don't know how to adapt after it is. So when you need help, contacting any of, getting in touch with your local aging services would be a great option. Actually talking to your physician is always a great initial source for them to direct you as to the right people to get in touch with.
This next question may be a little more than we can handle in the time we have, but asking, can you give some tips for choosing an assisted living facility for my parents?
Okay. I have people ask this all the time, and the answer I always give is show up unannounced. If you really want to try to find a great facility, show up when they're not expecting you to come there, so you can really see how they treat the people that they're taking care of, and maybe showing up a couple of different times. You get a feel for what the facility is like just by doing that, and not always take your first impression, but really look at the facilities, talk to some of the people involved. I always tell people kind of look at what their staffing ratios are, and do they have a lot of vacancies, because when your parents have needs, sometimes those are the pieces that are really important to know. And then looking at what are they going to offer for my parent. If my parent's going to be living there, are there some activities that they enjoy? Or what is my parent's personality, and what are the things that my parent enjoys doing? Really trying to find a place that meets your parents' needs and helps match them to their needs, versus trying to just find a facility that may look nice or offer all these promises. I think it's really a matter of looking at it, talking to people who live in facilities, getting some references. I think personal references are great because they give you really kind of the inside picture of what to look for.
Very good tips. We have another question. We're referring to the exercises. Someone asked, may I just start these exercises with my dad? I think it would be very helpful for him.
It's always best to consult with the physician before beginning or changing anything with regards to an exercise program. It may simply require a phone call, sometimes a visit into the physician's office, but it is best to talk with your healthcare provider before you start or change an exercise program.
Very good. Very good question coming up here. Do you know of local resources to help grown children convince their parents that they are hoarding stuff that they will never use in their lifetime? We have a parent who started hoarding 10 years ago, and prior to that time, the parent was neat and tidy. So the whole issue of hoarding, we hear a lot about that in the media, but it's a very serious problem.
This is really interesting because there may be some psychological reasons behind their hoarding, and so I think probably one of the first things is to maybe have them evaluated by their physician. There's some testing that can be done, like a neuropsych testing, which could determine maybe their level of competence. Maybe there's some kind of an imbalance. We talked about imbalances and medications and confusion. So there could be a little bit of that that's going on that might cause that. It's really hard to know for sure without knowing who your parents are. I think that's one of the hardest things, is talking people into getting rid of stuff that they feel might be important. And it may even be one of those things where the family has a family conference and sits down and says, Mom and Dad, this is not stuff that we are really interested in having once you're gone, or let's consider giving this to your grandchildren now versus saving it because they don't have a use for it, and choosing to go through things that way. I think it's really hard because they're somewhat, they may be isolated to their home, and so they're holding on to things a little bit more tighter because of that isolation. But like I said, there could be some underlying mental illness going on that's causing this, and you'd want to make sure that you're addressing that before you start adapting their environment to a way that they may not want it.
Good advice. I believe we have covered all the questions that have been submitted to us, but if you have additional questions, please call Brenda at 319-285-5555. 221-8594, the number that is on your screen, or email her. If you get a voice message, she will return your call. A tape of this program will be available at mercycare.org/live, so you'll be able to check back here in a couple days to review the exercises that Colleen discussed. You can always check this website for information about future webinars and listen to past webinars. Our next webinar, Breast Health Updates, What You Need to Know, will feature Katie Feldman, nurse practitioner. This will be October 18th at noon. Again, she'll take your questions live after her presentation. I don't believe we have any additional questions, so thank you all for joining us.